Often people will compensate for this without even realizing it. They'll drop their shoulder down, and that creates that angle that the deltoid needs to then be able to work. So if I was going to brush my hair and I couldn't do that at first, just dropping my shoulder down gives me that angle, and then the deltoid can be brought into activity. So this first muscle crosses under the spine of the scapula, under the acromion rather, in this little arch right here. And it comes off of the supraspinous fossa, comes through here, over the top of the humerus, and attaches to the greater tubercle. All right, so it's the first of our rotator cuff muscles. I need to wear these things in a little pocket around my neck.
Oh my gosh, like the makeup artist, you need a little apron so you can like pull your markers.
So supraspinous fossa. So this muscle fills in this space and then sends its tendon, which I probably should draw in a different color, but sends its tendon over the head and attaches to the greater tubercle. Right? So this would be the supraspinatus muscle. Supraspinous fossa, supraspinatus muscle. And it forms the support of the tendon superiorly. So this is supraspinatus right here. All right, the supraspinous fossa. And then the next muscle has a lot of horizontal fibers. So this is one of our strongest muscles for that external or lateral rotation. So these fibers are found having their origin from the infraspinous fossa. And so you can see how they support the tendon in that fashion. So starting from the infraspinous fossa, remember this is a posterior view. You're going to wrap around in that fashion. I should put that in a different color contrast. And then, so that's the I of sits. Our rotator cuff muscles spell the word sits. So the S is supraspinatus, doing abduction. I for infraspinatus, doing lateral rotation, primarily some extension certainly. The next muscle comes off the lateral border, but it also inserts onto the greater tubercle. This is round muscle, and that is teres minor. Teres minor and deltoid are the two muscles innervated by the axillary nerve. So if you look at your model, here is supraspinatus. This is the trapezius that's been cut, but here's supraspinatus right here. Okay, right there. And then all above my fingers to the spine. So all of this muscle from here up to here is infraspinatus. Teres minor is this bottom one right here. So infraspinatus looks like it's 2 or 3 different muscles, but it's all one muscle except for this lower portion right here. Okay? And that's teres minor.
Where was teres minor?
I'm going to walk around and show you. So teres minor right there. So teres minor. All of this is infraspinatus, teres minor. Okay. All of this is infraspinatus, teres minor, and this is teres major. Right. So supraspinatus, infraspinatus, teres minor, and teres major. This is the minor and major, and all of this is infraspinatus. We're going to do major and they do have separate functions today. So we're going to set up to do those that all right, so supraspinatus here, infraspinatus, teres minor, and teres major. That's axillary nerve right there. If you look just under inferior to where teres minor is attaching to the bone, you'll see a yellow nerve, and
you say axillary is what goes through teres minor?
It goes between teres minor and major. Actually, yeah. So suprasinatous here. Because he's had it, and Charles had. I won't label them on that part. It's only a small part. And all of this is suprasinatous, teres minor, split by the tricep, and then that's teres major there.
Have you done your case study yet? Because your case study is like improve your grade by like yeah, just one yellow. Oh.
Okay.
Which is the best
So,
part.
axillary nerve is coming off, so you can see it best right there. Okay. So suprasinatous, infraspinatus, all of this. Teres minor, teres major. It's split by quadriceps. Makes it an easy way to show it. The axillary nerve right there.
Gracias.
All right, so this is the S, I, and T of our sits. The S, the second S of sits, is an anterior muscle. That's subscapularis. So turn your upper extremity over so that you're looking at the anterior surface. So if I can borrow it. So we're looking at this way to see those muscles. Turn it over this way and you can see subscapularis here and teres major down here. All right, so subscapularis has its origin off of the, guess what? Subscapular fossa of the scapula. And instead of attaching to the greater tubercle, it's going to attach to the lesser tubercle. So this would be the anterior view.
Oh my gosh.
Coming off the subscapular fossa would be subscapularis. And so, Terry, this is having its origin medial to the muscle, if you will. So it's going to do medial rotation. Okay, but it's also going to do abduction. It's going to be able to pull it in. But it's going to be able to do medial rotation because it's coming across from the back side, kind of at an angle like this, and grabbing onto the lesser tubercle and rotating it inward. All right? So this is the S of our sits. So it also supports the tendon. Supports the joint. And all of the joints, superior, anterior, and posterior supported except for the medial surface. So looking at the PowerPoint from online, this was mislabeled as if it was a posterior view. So this particular one was labeled infraspinatus and teres minor, and those aren't even on there. So this is an anterior view of subscapularis. So that's the muscle that you're seeing here. And here's the coracoid process, so we know it's the anterior view. So all of this muscle coming to the lesser tubercle is providing that anterior extra support for the joint. And then the last muscle of the scapular group, again, is teres major. Notice teres major is coming up here and going to the lesser tubercle, but also to the shaft. So I'm going to draw that in a different color. So teres major comes off posteriorly, and there's a split, but then it travels anterior to attach to the front of the humerus. All right, so you come up here. I'm going to use you for a demo. Yeah, you.
Go, Natalie.
All right, so turn around. So this muscle is coming off. Just raise your hand. This muscle is coming off the medial border, especially the inferior angle. But instead of going to the greater tubercle like teres minor does, it goes underneath and attaches under here. So if you visualize it doing that, that's how it can do medial rotation, because it's going underneath to the front. Thank you. She's not going to forget this muscle. All right, so coming up from the back, but because it comes in front and grabs the humerus, it's going to do internal or medial rotation. Just like the subscapularis is coming from the back, but from the front of the scapula and coming towards the front. It also will do medial rotation. Okay? So teres major is too low to give support to the joint.
Oh, shoot.
It's coming from the back, so I'm going to draw dotted lines here to show it's coming from the back, posterior surface, and then coming up to the humerus. Alright, so the only two muscles that you need to know the innervation here are deltoid and teres minor, and they're both innervated by the axillary nerve. So the last muscle before we take break and some lab time is the latissimus dorsi. This muscle is kind of interesting. It starts from low in the back and swings up and kind of twists as it does so to attach to the shaft of the humerus. So it's coming from way down here, and you can see it on these small muscle men. So it starts from this fascia covering up the erector spinae, wraps around most of the lateral aspect of the torso, and then swings over and then kind of twists. Twists up here and attaches to the humerus. This is the muscle that if you go to the gym to work out and you reach up and grab a bar and pull down, what are you doing to the angle? You're increasing the angle. So this would have been flexion. Reaching up to grab the bar is flexion. Pulling down is extension. So that's one of the major functions of the latissimus dorsi.
Sounds like it should be the opposite.
All right, so let me keep my elbow straight. I'm flexing my arm, so 180 degrees. Now it's 90. Now it's 0.
You never know what angle we're starting at.
And the angle we're starting out is the straight line here.
Right.
So when you have a straight line, that's 180 degrees.
Right.
Okay? So if we look at geometry. So this is my straight line of my hand, my arm. We're almost done with the slides anyway, so let me just turn off. Okay, the light controls. The white one, here we go. All right, so that's 180 degrees. That's my arm, okay, the straight line. Then as I flex my elbow, I'm decreasing that angle to 90. And if I have my hand all the way above my head, I'm at 0. So that's decreasing the angle. Okay?
If you're just moving the line, the angle's not changing.
That's what I feel.
If it's your elbow, I get that. There's an angle.
Okay, here's my shoulder, here's my arm. So you have to kind of extend, the angle is at my shoulder.
Okay.
So the angle between my upper extremity and some point above my head. So now as I move my arm up, all right, now I've taken that angle to 90 degrees.
You're always you're starting at always in like the anatomical
Right.
position.
Okay, so this would be at 45 degrees. This is at 90 degrees. This is at 0 degrees. So I'm decreasing the angle. Now I'm increasing the angle. I'm going from 0 to 45, or 135 to 45, that 90, 45, and 180. So this is flexion, and this is extension. Okay?
Now is that coming laterally or
It's going in front of and behind. Going out here is abduction, because I'm moving it away from the midline. So the forward movement is flexion. This is extension and hyperextension. Again, depending on if it causes pain or just going past 180. There's a couple of different definitions. All right. So the latissimus dorsi comes from the back, comes from posterior, wraps up and goes to the medial aspect of the arm. So it's going to be able to extend. So I flex my arm to grab those bars, and then I extend. Okay? It doesn't work if you talk about pull-ups, because now I'm using my elbow as well to do that. So it works better to talk about pulling down the bar. And so when I'm pulling down the bar, a lot of that force is generated by the extension, pulling my arm back, and therefore I'm using because it's so much lower, the latissimus can provide a great force for that. The deltoid works too, all right, but the latissimus dorsi is so much lower that it provides a greater angle of force, even though it's not as thick a muscle.
And that's right here, right?
It starts down here, and then wraps up.
Under the armpit, right?
Under the armpit, yeah, and then crosses the armpit, yes.
So you're saying flexion of muscle, then technically wrong. It's like the skeletal position that's instead of flexion.
Yeah, I think that's.
You're flexing the joint. Yeah, so the skeletal, you're not flexing the muscle, you're contracting the muscle.
Yeah, so you say flexion bicep or tricep, that's not really a thing. So you're
Right, so the biceps brachialis flexes the elbow joint or supinates the radius. So the triceps brachii would extend the elbow. Yeah, you're not extending the triceps. It's the bone that's moving. The muscle is actually getting shorter. So yeah, it's the joint or the bone of the joint that's actually being extended. So you're extending the elbow, extending the shoulder joint. So you're using the latissimus to extend the shoulder. Yeah.
makes sense with that, the way you hear flex,
Yeah, it's probably just a slang. I mean, a quick.
Talk about flexing muscles, normally if you hear someone saying it.
Yeah, you flex your muscles.
Yeah.
That in that sense, I think all they're saying is just contracting.
Yeah.
It's not. Yeah,
Yes.
exactly. All right. So before we take a break, the axillary area. If we're thinking about the bodybuilders, all right, and I can grab my pec major, but even if I was in a swimsuit, you wouldn't be able to see much of a border. So my axilla is the armpit. All right, pec major in these bodybuilders or anybody that has more muscle than I do. The anterior border of the axilla, if you were to grab that muscle right there, is your pectoralis major. Okay? When we get through a few more muscles, I'll show you some images of these bodybuilders. They can be a little overbearing sometimes. And you wonder if they're photoshopped when they've got a trapezius the size of a wine barrel on their back. And then the latissimus dorsi is the posterior border of the armpit as it crosses over to the shoulder. So both of them to the arm. Both of them are crossing, and pectoralis major is crossing anterior. Latissimus dorsi is crossing posterior, and they're both going to the shaft of the humerus. Okay? And so we have the anterior and posterior border of the axilla with those structures. All right, so let's stop there and take a break as well as lab time. And